So there's different types of stress injuries, and they include both shin splints, stress reaction, and stress fractures. Shin splints are pain within the periosteum of the tibia, which is the outer layer. And this can be painful through a distribution of the bone, typically caused by increased running and not being in shape enough at that point. Stress reaction is more of an imaging type situation where we see inflammation in the bone, but there's no fracture. A stress fracture is a true fracture through the bone caused by repetitive injury to that bony area. If we can slowly increase your activity over time, we should be able to prevent stress injuries. That could include making sure you have proper nutrition, exercising appropriately, making sure you check with your doctor prior to exercising to make sure that you're healthy enough, whether that's your bone density or other electrolytes that can sometimes play a factor in bone health. All this is very important, but ultimately making sure that you slowly progress your activity level as we continue to exercise. There's not really any specific exercises that you can truly stop a stress injury from occurring. Obviously, making sure we take time to slowly increase your exercise load is going to be the most important part. The symptoms that can occur with any stress injury will be pain in a bone, and this does not always have to just be in the leg. It can be any bone that you're doing repetitive use with. For instance, in the bone such as your tibia, which is the long bone of your shin, you can have pain in a diffuse area with shin splints, and then over time can slowly progress to a kind of pinpoint location along the tibia. And when that occurs, that's where a little bit more indicative of a true stress injury or stress fracture to that bone. Either way, we're going to ultimately take you out of any high impact activity, and if there is a fracture, sometimes this could even be a surgical issue. So this is where it's important to make sure you're with a physician. When you see a physician, they're going to do a good, thorough evaluation of both your history as well as a physical exam. Ultimately, imaging likely will be taken, such as x-rays, but ultimately your physician may decide that they might want to do more advanced imaging, such as bone scans, MRIs, and CT scans. The return to play window for a sports-related stress fracture or any other stress fracture is going to be dependent on what level the injury, whether this is shin splints, a stress reaction, or a stress fracture. They all could be variable. Ultimately, all of these will need to be asymptomatic and have no pain before we actually let you get back on the field.